the benefits are huge because we're in a position where, for example, to make a decision about land use, to make a decision about environmental conservation or preservation, to make a decision about schools or hospitals or any of those things that are in the public good and in the public domain, we need to have the best data sets we possibly can. You know, a good example at the moment is the state of the environment.
The pace of change and the pace of growth and pressures on the environment are increasing. We know population's growing at a greater rate than it ever has. And developing our ability to understand in a more real-time fashion what is the consequence of the pressures on the environment is really important. So for me, I think investing in this area over the next decade is fundamental.
As the leader of a research centre at a university, we believe that if the organisations and the industries that we work with advance their practices in this area, then we'll have opportunities to collaborate with some of the best researchers in Australia and internationally, because we can help implement experimentation in new areas for data sharing or new disciplines. I think for those in industry and community, it's the evidence-based planning.
Well, I mean, you should not just be making decisions or trusting a politician to make the right decisions. You should be driven by the data. Do we need that tunnel? Do we need the hospital? Do we need that train station? Why? Rather than someone's just agreeing to it because for whatever reason. And so the transparency of how information is collected and used to make decisions for the benefit of us all is something that I think many people are interested in.
I think there's no question about the fact that data, in research at just about every single level is critical to the future of how we live, where we live, and how long we live. The amount of data that's been collected in the health field at the moment is going to make a difference in so many different ways.
Looking at correlations between people's interactions with health and education outcomes. So starting to look at these kind of very large complex data sets of how citizens are interacting with government services and what the causal relationships are. So does it make more sense to invest in a particular health outcome or a health intervention? What does the impact on educational outcomes look like? So looking at the system in a really holistic way. And in the past, we would have made policy decisions and investment decisions in those two domains separately.
And in the whole area of agriculture, one of the things that we're aware of is that the population of the planet is growing massively. The ability to be more efficient in how and when you plant crops and you rear cattle, comes down to having masses of data about how deep the water goes down in your soil, when the water will be there, what happens if you have patches within a particular paddock or a particular field that are different. So if you have the data coming off the fields, and if you've collected over a period of time so you can see the cycles, you're likely to be more efficient in how you grow your crops. And if you are more successful and there is more food, you are likely to have what we consider to be better food security.
In my space, we see a lot of benefit in making data that is available to decision makers in the environment space more widely and openly available. I think there are innovation outcomes in that space. If the data is available, you don't have the transaction cost of going and collecting the data yourself. You can, being a business, can innovate on top at a very low cost. So I think there are some innovation outcomes there. And in terms of the relationship between citizens and government, I think there are some clear kind of transparency and accountability benefits in having access to available data within the rights-based approach. If people have a right to see that data and if it doesn't disbenefit citizens.